Welcome to The Explainer. If you're navigating the world of fertility treatments right now, it can honestly feel like you're having to learn a completely new medical language overnight. It's overwhelming. Today, we're going to walk through a very specific IVF technique together called assisted hatching. And I want you to think of this not as some intimidating medical intervention, but really just as a supportive guide to how your medical team can give your embryo the absolute best possible chance to thrive. We're going to break down exactly what it is, how it works, and who it helps most. Okay, let's dive into this. When you're going through IVF, literally everything you do is building toward one beautiful, ultimate goal, right? A successful pregnancy. And the very first critical step of that journey inside the body is implantation. That's the magic moment an embryo actually attaches itself to the lining of the uterus. But for that connection to happen, well, the embryo has to be ready and the conditions have to be just right. So what actually allows that embryo to successfully implant? To understand how we can help that process, we first need to look at the physical makeup of the embryo itself in those really early days. Every single embryo is surrounded by a hard, protective outer layer of cells. Now, in the medical world, they call this the zona pellucida. But for us, we can just think of it as a microscopic shell. And it is incredibly tough for its size. Honestly, it's a brilliant piece of biological design meant to protect the embryo while it develops. But here's the catch. For the embryo to finally attach to the uterus and actually begin a pregnancy, it can't stay inside that shell forever. It has to eventually break free. Or, as embryologists call it, it needs to hatch. If it doesn't hatch from this protective layer, implantation simply cannot happen. Now, in a natural pregnancy, this hatching process happens entirely on its own. As the embryo grows and reaches what we call the blastocyst stage of development, that protective outer shell naturally begins to thin out. And how does it do this? Well, the growing blastocyst actually goes through this repeated, rhythmic process of expanding and contracting, kind of like a gentle heartbeat. This active movement alters the elasticity of the shell. Eventually, it gets thin enough that it simply tears open, and the embryo hatches out beautifully, completely ready to attach to the uterine wall. It's a miraculous process, truly. But let's be honest with ourselves, sometimes nature just needs a tiny, gentle boost. Going through IVF means you're already taking proactive steps to help nature along, right? And sometimes, for a variety of reasons, an embryo might struggle to thin out and break through that shell completely on its own. It's completely valid to wonder, well, what happens then? What if the shell is just too thick, or the embryo doesn't quite have the energy to break out? That is exactly where science steps in to offer a reassuring hand. Which brings us to assisted hatching. Just as the name implies, this is an additional, incredibly carefully performed procedure done during your IVF treatment. It's basically designed to give your embryo that much-needed gentle boost we were just talking about. By stepping in and physically assisting the embryo to hatch from its shell, your clinical team is actively increasing the chances that it will successfully break free and ultimately implant in the uterus. It's this really beautiful marriage of technology and biology, completely designed to remove a physical barrier to your pregnancy. And this brilliantly illustrates exactly how this highly controlled, precise process works in the lab. First up, a trained embryologist uses a targeted microscopic laser. Now, I know the word laser can sound a bit intense, but in this context, we're talking about an incredibly delicate, state-of-the-art tool. Next, using this microscopic laser, they create a very small opening, just a tiny perforation purely in the outer shell of the embryo. They do not touch the embryo itself. Finally, with that tiny gateway now open, the embryo is safely transferred to your uterus. This is generally performed on the exact same day as your embryo transfer, making it a completely seamless addition to a day you're already prepping for. Now, a super common question patients have is how quickly does this actually work? And it's important to know what to expect here so you can set calm, realistic expectations for yourself. While the embryologist has created that opening we just talked about, the actual hatching, that is still a natural process. Assisted hatching doesn't just instantly drop the embryo out of its shell, and it certainly doesn't artificially speed up implantation. What it does do is make that natural process significantly easier. The hatching itself might take anywhere from a few hours to a full day after the embryo is transferred into your uterus. So your body and your embryo are still doing all the incredible work, they just have an open door to make it a bit easier. So who exactly is this for? Listen, your fertility doctor isn't going to recommend procedures you don't actually need. They're specifically looking for signs to offer tailored care, so you are uniquely supported. Assisted hatching is very often considered if you've experienced previous failed IVF or ICSI cycles. It's also incredibly helpful if the lab notices that your embryos happen to have an unusually thick shell. Some other factors might include elevated FSH levels in the early part of your menstrual cycle or older maternal age, since older women tend to have embryos with thicker outer shells. Ultimately, if the lab sees that the embryos might just be of a quality where self-hatching isn't really expected, they'll step in to provide that extra support. But what about frozen embryos? If you're planning a frozen embryo transfer, or FET, you might be wondering if this applies to you at all. Well, the short answer is that assisted hatching isn't strictly mandatory for frozen embryos. Lots of them thaw and implant wonderfully on their own. However, it can absolutely be done on previously frozen and thawed embryos. In fact, it's often highly recommended just before transfer if you've had previous failed cycles or if the shell appears a bit thick. Think of it as just another tool in the toolkit to make sure your frozen embryo gets the best possible welcome when it's transferred.
Now, what's really interesting about this slide is how it breaks down two different terms you might hear tossed around together at your clinic: assisted hatching and PGTA. It is super easy to confuse them, but they actually serve completely different primary purposes. As we've just learned, assisted hatching is all about helping the embryo break out of its shell to aid implantation. PGTA, on the other hand, is a genetic test used to check the chromosomes of the embryo itself, so they are entirely separate procedures with completely different goals. But, and this is a pretty big but, they are intimately connected in the lab.
Let's move to and see how this builds. Actually, let's look at exactly how these two procedures are so closely connected. If you and your doctor decide that PGTA genetic testing is the right move for your journey, then assisted hatching actually becomes a clinical requirement. And here's why. To test the embryo's genetics, the embryologist has to safely remove a few cells for a biopsy. To do this without harming the embryo, they perform assisted hatching, usually around day 3 of its development. This creates that tiny opening so that by day 5 or day 6, a few cells will naturally sort of poke through that hole. This brilliant little trick allows the embryologist to take a tiny sample from the outside, keeping the rest of your embryo perfectly safe and intact. Of course, whenever we talk about microscopic lasers and physically manipulating an embryo's shell, the absolute most natural question a future parent is going to ask is, wait, is this safe for my baby? So the crucial point is this. There is absolutely no evidence that suggests assisted hatching causes congenital disabilities. None. When this procedure is performed by highly trained embryologists using precise, targeted techniques, it's considered extremely safe and does not increase the risk of fetal abnormalities. You can have absolute peace of mind knowing that this is a proven, delicate technique designed to do one thing and one thing only: to help. Navigating fertility care is, frankly, a journey of 1,000 tiny steps. And sometimes, a microscopic opening in an embryo's shell is exactly the gentle boost your body needs to welcome a new life. Every patient, every cycle, and every single embryo is completely unique. If you faced hurdles in the past, or if you feel you fit into any of the profiles we talked about today, well, what does this all mean for you? It means this could be a really wonderful conversation to bring up at your next appointment. Ask your doctor and your embryologist if assisted hatching could be a useful tool for your specific journey. Could this gentle boost be the key to your IVF success? Thank you so much for joining me for this explainer. Stay hopeful, keep asking those great questions, and please take care of yourself out there.